Jay, why don't you tell everybody who you are, your name?
Yep, I'm Dr. James Mahoney, and I'm an osteopathic physician.
And what is the difference between an osteopathic physician and a regular kind of MD?
Yeah, so an osteopathic physician is a fully licensed doctor. We do all the training that MDs do so that we can perform surgery, we can prescribe drugs, but we also learn structural medicine. So we learn how to do all the type of work that chiropractors do with hands on a patient, doing manual medicine. And because we have all of that training, we put it all together. And we're probably the most complete doctors that there are. And if you ask a DO, they'll say, you know, they're the best doctors. So that's a matter of opinion, yes, in all humility. So
and then I've been your patient for
a long time,
over 10 years.
Yeah, right, a decade. So
yeah, and I've always kind of had a little bit of elevated cholesterol, and you and I have had conversations about that, and my kind of dogmatic belief that I'm not going to take these drugs.
Right.
And my research that half the people that have heart attacks have normal cholesterol, half the people have elevated.
Right.
And you were truthful with me in that is a true statement. Mm-hmm. So what are your thoughts on me kind of being dogmatic?
Well, my thinking on it has morphed over the years, where when my patients were younger and nobody had heart attacks, I was thinking, well, be very conservative and don't use statin drugs and use these natural things only. And then in the last few years, as my patients are getting in their 60s and 70s, and a few of them had heart problems, and so now I'm a little more liberal with statin drugs, but I've always leaned towards, if there's a natural solution, by far it's the best way to go. Unless your cholesterol is really, really high, that the use of statin drugs is probably something you want to wait on until you've tried other natural stuff. And it's still in flux, but I think the stuff we're going to talk about today is really, it's pretty exciting about, you know, the opportunity we have to treat cardiovascular disease and just preventively, specifically in my case, get in front of it so that you don't have cardiovascular disease show up at all. I'm not anti-statin, but I'm very conservative.
Sure.
Yeah.
And then obviously I started a natural protocol and had some pretty remarkable results,
yes,
which I brought to you.
Right.
What tell us your reaction and what you saw.
So I'm very familiar with natural treatment. I've read about Dean Ornish and his diet plan, which reverses heart disease, but it's so demanding. You have to do a really, really intensively controlled diet. Very few people wind up doing it long term. And so reversal of heart disease to me is the holy grail, but really couldn't do it. Statin drugs help. They reduce the risk of heart disease in people who are seriously ill, but it's really hard to make heart disease reverse. So when you came to me and you said, my calcium score was high and I've been doing this protocol with vitamin D3, K2, and serrapeptase and nattokinase, these enzymes, and it's, according to my big shot MD, PhD guy, it's supposed to reverse coronary calcium. And I'm gonna ask you if you'll order a test. So I ordered your test and it came back and your coronary calcium had gone from, give me the numbers.
58.
From 58 to 0.
Yeah.
Right. So 58 has some risk associated with it.
Right.
Zero means that no matter what your cholesterol numbers are, that you don't require a statin drug. Typically you don't require a statin drug, you don't require any treatment because you're not plaquing. You're not creating a coronary artery disease. So I called one of my cardiology buddies right away. I said, oh my gosh, you can't believe it. This patient of mine, and he did this thing, and we talked about it before he did it, so it seemed like it made sense, but it actually worked. And he said, it doesn't really mean anything. To lose coronary artery calcium is not a big deal. We don't really worry about that. I said, well, have you ever seen it before? He said, no, but we don't worry about it. So I was like, come on, that's pretty exciting. Doesn't that make sense that that would mean that he's going to be healthier? And he said, well, there's no data to support it. So I thought, well, there may not be data to support it, but that's because it's natural treatment. And I don't know if like the word censorship means anything to anybody, but it's one of those things that the medical world is very, very aggressive about keeping natural treatments quiet and really promoting drug treatments. But there's been a rich research base for nattokinase and serrapeptase, D3 and K2. All these supplements have been well researched. But in clinical studies, they just have not really been looked at because there's not much money in it. But clearly there's evidence to say that this should help. And in your case it did, then I did it.
Right.
And I started a year ago doing the same protocol. serrapeptase, nattokinase, that's the enzyme blend, and D3 and K2, which is just a really good vitamin D supplement. That's the way D3 supplement should be with K2. My old calcium score was 780, which is extremely high risk, and my whole family is high risk. My dad had heart disease, and I clearly was heading that way. A little bit of high blood pressure, high cholesterol, the whole thing. But after a year, I had my study done, and I had what's called a coronary CT scan with an angiogram, and they put dye in your vein, it runs through your heart, and they use artificial intelligence to study the amount of stenosis in your blood vessels. And not only did my calcium score drop from 780 to 216, which is about a quarter of what it was, which is very exciting. It puts me in very high risk to, like, you've got some risk, but not a lot. But I have zero stenosis. So the blockage in my arteries, my assumption was, because of my family history, it'd be moderate to severe in the ones that matter. I'd had some symptoms, chest tight once in a while and stuff. Maybe because I had anxiety about heart disease, I'm not really sure. When zero stenosis comes back, zero severe, no moderate, I have a little tiny bit of mild stenosis. It was stunning to me. The fact that my coronary calcium dropped, similar to my cardiology buddy, that doesn't mean a lot. But that I have no stenosis, I don't know. I didn't get a previous angiogram, so I don't know that it was that way before. But based on my history, it's highly unlikely that it was. And I do know that my coronary calcium dropped by 75%. And I'm going to continue to do it, because if I continue to get those kind of results, I expect it to drop further. And no matter what, the stuff that's in that enzyme blend does so many good things for your body generally besides. So it seems to be a really good natural health preventive approach for people with any heart disease, any family history. It just makes sense. And the only thing that stands in the way of doing that is if you're already on a blood thinner, you don't take it, because you've got to get checked out with your doctor, make sure that that's okay. But unless you're on a blood thinner, it's kind of good.
And just for clarification, another word for stenosis is
blockage.
Yeah. Or plaques.
Yeah, right. So that, like, that if you look down the artery, a stenosis is a plaque growing, and a stenosed artery is closed up altogether. There's no way to get through it. If it's 50 to 70%, that starts to get significant. And mine was like 17% total, like the total amount of stenosis, like it's completely inconsequential. So until you get to 50%, it doesn't even matter. So I'm like totally clear, which was, I don't know, my chest tightness went away. So I'm not going to say that was a treatment for that, but I'm sure I had some serious anxiety about it. And once I had that test done, and the test was totally cool too, that artificial intelligence study in that, and all this stuff is cutting edge. Like the testing, the protocol that you're doing, it makes sense to have a really good professional help. Like, make sure that you get a really good cardiologist if you got heart disease, and work with him and figure out what do you need to do, and then make an intelligent decision. If you have a borderline problem and you're not going to be at risk, it makes sense. Do a natural approach. And there's lots of really good doctors who know about natural medicine, and they can help you with that stuff. I think it's really foolish to like proceed, because Mike, you went with my permission. We looked at your stuff. We were doing the stress test, and the coronary artery calcium and all this stuff. And I think we're going to go ahead and do a more advanced study like the one that I did with the artificial intelligence. So you do it intelligently, and then you have this opportunity, which is amazing, to go ahead and treat yourself proactively. And it not only reduces plaque in your blood vessel, but it reduces scar tissue throughout the body. It reduces inflammation. It does all sorts of other good things. And it has a real strong vitamin D dose. And vitamin D helps with depression. It helps with the density of your bone. And it helps in the defense against cancer. So all these other things that vitamin D is good for, so everybody should be taking some, probably. It just seems to make sense to do a proactive, preventive approach. And then you have a whole lot less to worry about, and maybe your chest tightness will get better. I'm not really sure.
Absolutely.
Yeah.
Okay, last question. There's a lot of information right now that inflammation and chronic inflammation is really, really bad. That's what's causing so many things.
Right.
And all four of these individually have strong anti-inflammatory properties. Can you just speak to that? Your thoughts on inflammation?
Sure. So inflammation is the cause of almost every serious illness. So 50% of men in the United States die suddenly of heart disease. That's the first time they know they have heart disease, it's sudden death. 50% of men, or recent studies have shown that. That's caused by inflammation. Inflamed cholesterol in the arteries block the arteries, gum it up, causing stenosis, and then you die. It's inflammation that causes that. I study inflammation when I see a patient for the first time. We get a C-reactive protein, some other things that show inflammation, but C-reactive protein especially. And if it's elevated, that patient's at risk. Nattokinase and serrapeptase are known for their anti-inflammatory, they're strong anti-inflammatories. You swallow them, they go through your stomach lining and intestines and into your body, and those enzymes actually act inside your body to reduce inflammation by digesting scar tissue and directly act on the inflammatory system to drop inflammation, which reduces your risk of cancer, heart disease, Alzheimer's disease, which is amazing. Part of the whole natto story is that it digests amyloid plaque, which causes Alzheimer's, and there's lots of studies going on currently to show that it reduces Alzheimer's. Inflammation in Alzheimer's, that's brain disease, heart disease. It goes on and on. So anything that you can do that's anti-inflammatory is good for you. And we know that the drugs, the NSAIDs, cause stomach irritation, kidney problems, but the natto and serrapeptase don't. Vitamin D3, as you know, is just totally safe. And the vitamin K2 is an adjuvant therapy. It helps, it tweaks the effect of anti-inflammation, of the effect of grabbing calcium and stuffing it in the bone, taking it away from scar tissue and stuffing it in the bone where it belongs.
Amazing.
Yeah.
Okay, last question. Sorry, I said last one was the
yeah.
last, but this really is the last one.
Okay.
You talked about experiencing tightness in your chest and really the emotional weight of having, coronary artery disease. And just share with the folks just what your thoughts are on just having that lifted off of you.
Yeah, so it's interesting because I had some back surgery and some other things and some health challenges. I'm in my 60s, and I'm thinking, but the one thing is, it's like, doesn't matter because I'm going to die of a heart attack. No matter, I'll take a statin drug, but I'm doomed to this fate because that's my family history. So, but then I got that test done, and this is just in the last month, and it showed zero stenosis of any severe kind, zero moderate stenosis, and only a little tiny bit of mild stenosis. I'm still kind of reeling. I'm still kind of processing what that means. I got to take care of the rest of me now, which is good. So I'll keep doing this because it's the inflammatory treatment and improves bone. And vitamin D also. What is also great is it improves muscle quality. And we know that a muscular person has the greatest chance of longevity and living not only long but well. So now I'm kind of shifting my focus from I'm going to die young to I'm going to live to be old. So I better take care of myself. So yeah, so emotionally, really honestly, I'm still digesting all of it because it's a big relief. So.
And according to all medical knowledge, this can't happen. This doesn't happen.
Well, the guys I talked to said they'd never seen it.
Right.
And I don't even think it's looked at. I don't think people even look at it because it's inconsequential. If you have a high calcium score, you need a statin drug and that's the end of it. Where with what we're looking at is if you have a high calcium score and we can actually study your intraarterial stenosis and we can get your calcium scores down and your stenosis tracks with that, we may have a really potent alternative to doing traditional treatment, which would include stents and cardiovascular surgery and potentially just a lot of medicine, which is one of the other ways to go. But if we could treat that with a safe natural alternative, that would be really, really great. And I think of it in my practice, everybody I see who has cardiovascular risk is going to be offered the opportunity as one of their options. They can take statin drug, they could take this, they could do nothing. And that kind of the osteopathic model is you have all the different things that you can do and you offer a patient which one would you like to do. And we make sure that it's safe. And then with this especially, the only risk is if they're on blood thinners, and I would know that. So I'm optimistic. We're going to have a good time watching how patients do with this and following their studies, and hopefully there'll be some good research that comes out on it.